In today's podcast, you'll learn about questions and comments you might hear when you go to the doctor, so that you can understand what he or she is saying to you. Welcome to
Aprender Inglés with Reza and Craig.
Hello and welcome to the podcast, especially if you're a new listener. It's lovely to have you. My name's Craig.
And my name's Reza.
And with nearly 60 years of teaching between us, we're going to help you improve your English and take it to the next level. Now, as we record this podcast, it's nearly the end of the year. It's just around the corner, isn't it, Reza? It's approaching fast.
Yes, we're almost into the festive season, that term which can describe Christmas and New Year.
Are you looking forward to it?
I am. I always enjoy the festive season. I'm not obsessed with it. I'm not like one of these people who starts wearing ridiculous Christmas costumes from November. But when the time comes, I do enjoy it, I have to say. What about you?
Yes, I am. I always love the end of the year, not necessarily for Christmas because I don't have kids, but I do like reflecting on the year that's gone by, looking forward to the year ahead and just chilling out and taking it easy. And speaking of taking it easy, let's listen to our friend Javi from Madrid who has sent us a voice message.
Hello, Craig. Hello, Reza. It's Javi from Madrid. I'm sending this voice message to tell you that I have finally got the English C1 certificate. It's been so difficult and has taken a lot of time and effort, but I got it. And I would like to thank you because your podcast has been very useful for me. I have learned a lot from you and you made it so enjoyable. Keep it up because I'm sure you're helping other people beside me. Thank you.
So speaking of taking it easy at the end of the year, I'm sure Javi is taking it easy after successfully passing his C1 certificate. Well done, Javi.
Yes, congratulations, Javi. And I do really know how you feel. Remember, listeners, it took me 3 attempts to pass my C1 in Valencia, the local language here in Valencia. 3 attempts. So I know. Try again until you finally succeed. And that's what you did, Javi. Well done.
Fantastic. Really, really good news. There's just one thing I noticed about your very, very effective and clear message, Javi, and that was a confusion between beside with no S and besides. What's the difference, Reza?
Well, I think what you wanted to say, Javi, was you are helping other people besides me. I exaggerated the S there. You don't have to go like a snake, but I wanted to exaggerate that. People besides me. So with an S, it means as well as me. And what if it's without an S, Craig?
Well, that's a preposition. If it's without an S, so beside, that means next to. For example, Reza and I are podcasting in the same room together, and Reza is sitting beside me. He's sitting next to me. So be careful of the difference. If it's with an S, it means apart from. And if it's without an S, it means next to.
And Javi, one more thing. You said a phrase which I really liked, and I say exactly the same to you. Keep it up.
Keep it up.
That's what you said to us, and I say that to you. Your English is going really well. Keep it up, meaning continue to do what you're doing.
Maybe in 2025, you might consider looking at the C2 exam. Just a suggestion, Javi. Just something to think about during the festive season. Reza, what's the topic today?
So our topic today is understanding a visit to the doctor. Now, the reason we're doing this is because very recently in episode 546, so this is episode 549, so that was released 3 weeks before this one, we had an episode which was how to describe symptoms to a doctor. And we decided not to put any more in it because it would have been too long. So this is a good follow-on or follow-up to that episode. So now that you can describe your symptoms to a doctor, now we need to know what the doctor might actually ask you.
Exactly. So let's look first at some common questions. And we've deliberately thought of some maybe more colloquial, unusual language that's very, very common in British English that you might hear when going to the doctor. So not necessarily language you'd see in a course book if you're studying English, although it could be, but more what we think you would hear from a native speaker in the UK. The first thing you do when you go into the doctor's, we call it the surgery, where the doctor or GP, general practitioner, is sitting, the family doctor, you'll say obviously good morning, good afternoon, and the doctor might say, what seems to be the trouble? What seems to be the trouble? Or what brings you in today? What brings you in today? You also might hear, what's going on with you? What's going on with you then? How can I help? All of those expressions you might hear as an opening, the first thing that the doctor might say to you.
And then the doctor will want to start to get a bit more specific. So he or she might ask you something like, where do you have the problem? Or where do you have the pain? Or where do you have the itch? Or where do you have the rash? Or where do you have the discomfort? Or some similar word.
All of these expressions you can see in the show notes to this episode. Go to inglespodcast.com/549. And it's a good idea if you stop and pause the podcast and repeat these questions after us to practice pronunciation. Now, you won't be necessarily saying these unless you're a doctor, but it's good pronunciation practice to repeat after us. Another question you might hear connected to Reza's last questions, can you tell me where it hurts? If something hurts, it's painful, and the doctor wants to know where it hurts. So the question, can you tell me where it hurts? Or, could you tell me where the pain is?
So once the doctor has located the pain or the rash or the itch or whatever it is, they might want you to be a little bit more specific. So they might ask you, can you describe the pain or discomfort you're feeling? To do that, then that's when you can have a look at episode 546, which we did a couple of weeks ago, which is the language which you, the patient, need to describe the pain. So we have a link in the show notes. It's inglespodcast.com/546, where we've got language to describe pains and rashes and other things.
Another question you might hear from the doctor is, has this ever happened before? Has this ever happened before? Present perfect question, asking about any time in the past until now if you have had this problem. Has this ever happened before? Or is this the first time it's happened? Is this the first time it's happened?
Another question related to something which might not be new could be, how long have you had the pain? Or how long have you had this problem or these symptoms?
Doctor, I feel like a dog. How long have you felt like this? Since I was a puppy.
I should have seen it coming.
Are there any other symptoms? Is another question you might hear. Any other symptoms? Any other things that are unusual that you're experiencing? Pains or aches or anything out of the ordinary? Are there any other symptoms?
Here comes a question which I get asked every single time I go to see my specialist, because I've had arthritis for years and it causes pain. And every single time I go, the rheumatologist says, on a scale of 1 to 10, how painful would you say it was? So 1 being not too painful and 10 being the most painful? I always get asked that question.
I'm not sure how useful that is because pain is very subjective and some people have a very high threshold of pain, which means they can handle pain and accept pain relatively well. And some people, even the smallest, slightest pain is incredibly bad. So I don't know how helpful that. What do you think?
I know, but they always do. They always do
Yeah.
it. This is doctors. Rheumatologists, they always do it. I think it's probably more to partly see psychologically how you're doing as well, to see how it's affecting your life.
Yeah, that's a good point.
And they record it, by the way.
Yeah.
And quite often they give me a tablet and I do it myself. It's not very useful if they ask you just once, but if you're a long-term patient, then they can compare your results over the years. So mostly I say kind of 3, 4, but then occasionally there is the odd time where I say 6 or 7. So then they know, all right, he's not doing that well.
So they can see over time if it's getting better or worse with
Exactly.
with the treatment, with the medication. That makes sense. Yeah. Another question you might hear is, do you have any pre-existing medical conditions or past illnesses? Again, do you have any pre-existing medical conditions or past illnesses? So have you ever had anything in the past that could affect the diagnosis or affect the treatment?
Now, the next question is a question which could easily be asked by your mother as well, but doctors have their reasons for asking it. Have you been eating well? Or have you been eating properly? Is a common question because there are certain symptoms which are a result of not eating well. So you may well be asked, have you been eating properly?
Or maybe, how's your appetite? You might hear. How's your appetite? Another common, very common question, are you currently taking any medication? That could be asked by the doctor, or if you go to hospital, emergency, for example. Are you currently taking any medication? They need to know if you're taking medication, so that they can prescribe medicine or drugs that don't have any conflict or any negative effect with your current medication.
Yes, and related to that, they probably will also ask you, do you have any allergies? Because certain allergies to foods can also trigger allergic reactions to medications. For example, I can't remember which one it is, but there's a vaccination which I get sometimes, and they always ask me, are you allergic to chicken? Apparently, there's some vaccination.
Sounds like a joke.
No, I know, doesn't it? But if you're allergic to chicken, then there's a good chance that vaccination will give you a reaction. And another one is...
Get chicken pox.
Yeah, it might be that, yeah. And another one is eggs, I think I've been asked as well. If I'm allergic to eggs, just before they vaccinate, just before, it's no joke. And if you say yes, they probably won't vaccinate you. So there are certain food allergies which will trigger a reaction to medication. And then, of course, people can be allergic to specific medication. Quite a few people are allergic to antibiotics, for example.
Are you allergic to eggs? Yes, only when they're thrown at me. Another question you might hear is, when did you last have your blood tested? To have a blood test is where they take blood from you and they see if there's anything wrong with you from your blood. When did you last have your blood tested? I've just thought of another joke, Reza. You're losing a lot of blood. I'm going to give you a transfusion, a blood transfusion. What's your blood type? And the patient says, B positive. And the doctor says, I'm trying, but you've lost a lot of blood.
That's good. I like that one.
B positive, of course, is a blood type.
Notice the grammar used in that question. When did you last have your blood tested? Not when did you last test your blood? No, because you're not going to test it. You don't work in the laboratory where they test blood. That's what my sister does. She does, actually. She works where they do the blood transfusions. So she's a lab technician. She'll test your blood, but you, the patient, you will have your blood tested. It's to have plus something, your blood, plus a past participle. Like you have your hair cut or you have your house painted by professionals. Well, you have your blood tested by I was going to say the doctors, but actually I want to praise my sister a little bit. It's the lab technicians who test it, really.
Just a few words from me to give you a break from visiting the doctor. So it's nearly the end of the year 2024, and I just want to take a minute to say hello to all of you who have taken part in my conversation courses this year. I won't mention all of you by name, it would just take too long, but I want to let you know how much I enjoyed doing the courses with you. And it was really interesting to have such a diverse mix of nationalities, cultures, personalities, all communicating in English together in the group and sharing opinions, sharing your experiences, and sometimes sharing your stories, your personal stories. It was absolutely fantastic. Now, I'm going to continue with these conversation courses next year from the middle of January, more or less. So this is for any of you who have done courses in the past and you want to continue improving your spoken English, and also for any new students who are thinking about joining us because you feel you need to be a bit more confident when you're speaking English and become more effective communicators. So if you have studied with me before, and I already know your English level, just send me an email, say hi, and let me know that you want to join the group again and do another course. And if we have never spoken before, then also send me an email and I'll give you more details about the courses, the prices, and what you need to do to join us and take part. So the email address, Craig, C-R-A-I-G, @inglespodcast.com, and I'm looking forward to hearing from you. Thanks for listening. Now let's get back to the doctor. Another question you might hear, have you been sleeping well lately? Have you been sleeping well lately? Have you been having a good night's sleep? How's your sleep at the moment? Have you been sleeping well?
And last but not least, the very important question, is there anything else I should know? Because quite often doctors know that people are reticent to go into details. They'll tell doctors symptoms, but there may be a very good reason that they don't want to talk about, you know? It's like, imagine you had a rash on a very private part of your body. For example, and the doctors ask you questions about your diet, blood test and all that. But, you know, if you haven't told him about what you've been doing with this very intimate part of your body, he needs to know that. So he might have to say, is there anything else I should know? And that's when you say, well, yeah, I've been, doing things in the middle of the night in my bedroom with people that I shouldn't have been doing, for example.
Yeah, that's why I've got a sexually transmitted disease. So, moving on, here are some colloquial expressions you might hear. So we've looked at some questions the doctor might ask. Here are some colloquial expressions that the doctor might say to you. After some questions, the doctor could say, right, let's have a quick look at you. Now, you can use the verb to look. Let's look at you, but to have a look or have a quick look, that's more colloquial. That's using look as the noun, to have a look. So, right, let's have a quick look at you. That means the doctor is going to examine you.
And to look at you properly, you might have to remove some of your clothing. So the doctor might say, for example, just pop your shirt off. So to pop something off is an informal way of saying to take it off quickly in a very casual way. So just pop your shirt off. Or they could use a different word order and they could put the preposition beside the verb and say, just pop off your shirt for me. So both are correct. Just pop your shirt off for me, or just pop off your shirt for me.
So that phrasal verb pop off could mean take off in this context, and with a different preposition, pop up means get up or go up. So you might hear pop up on the examination table and we'll have a look at you. Or jump up, which is another informal phrasal verb. You're not literally expected to jump. It just means go up onto the table, onto the examination table. So you could hear, jump up on the examination table and we'll have a look. Or pop up on the examination table and we'll have a look. Yesterday, the doctor told me I was colorblind and I couldn't distinguish colors. And his diagnosis came completely out of the purple.
That's a good one.
Why is that funny? Out of the blue. It should be out of the blue. But if you're colorblind, you could say out of the purple. I don't know why I find that so funny. Back to the expressions, Reza. What's the next one?
Another phrasal verb, which doctors often use, is rule out. You might hear them say, I think we can rule that out. Or they might be very specific. I think we can rule out a virus. Or I think we can rule out chicken pox. Or I think we can rule out COVID, for example. If they can rule something out, that means they are sure that it isn't that. So maybe they don't know what you have, but they know what you don't have. They can rule it out.
And if you look worried or concerned from what the doctor's saying, the doctor might say, not to worry, which means don't worry, not to worry. I'm sure it's nothing serious. I'm sure it's nothing serious.
Yes, that's a very strange
not to worry
thing, isn't it?
Yeah.
Not to worry. Because normally imperatives don't work that way. Don't do that with all imperatives. Normally you would say, don't worry. Don't go there. Don't do that. Don't eat that. Don't worry. But it's just a specific thing that doctors say, not to worry. Or you can say it in a situation when you want to be positive. But it isn't the normal way to give an instruction. The normal way would be, don't worry. But doctors often will say this, not to worry.
Not to worry. It'll be okay. We'll soon sort you out is another colloquial expression. Or we'll soon get this sorted. So to sort usually means to put things in their place, to put things in their correct place. But in this idea of sorting out a problem or a medical condition, it means to solve it, to cure it, to find a solution. Don't worry, we'll soon sort you out. Notice the pronunciation. Sort you out becomes sort you out. We'll soon sort you out. We'll soon get this sorted.
So we've been using a lot of prepositions in our expressions. Here's yet another one, to keep an eye on someone. So the doctor might say, we'll keep an eye on it and see how it goes. Sorry, I said someone, it could also be something. The doctor might say, we'll keep an eye on you. Or he might say, we'll keep an eye on it.
Blood pressure, for example.
Blood pressure or the rash, whatever. We'll keep an eye on it and see how it goes.
Another expression you might hear when the doctor is talking about giving you a blood test is, we'll get your bloods done. We'll get your bloods done means we'll give you a blood test, examine your blood, as Reza said before, send it to the laboratory, get it checked by a technician and get the results. We'll get your bloods done.
And then they might say, we'll be in touch when we've checked your blood test. We'll be in touch. So they don't want to tell you anything till they know about the results. We'll be in touch when we've checked your blood test.
And obviously you don't want to be nervous or anticipate any bad news. The doctor might try to calm you down and say, let's not get ahead of ourselves. Let's not get ahead of ourselves, meaning let's not go too quickly here. Let's wait calmly and get the results first. Let's wait for the results to come back. So let's not get ahead of ourselves. We'll see what happens when we get the results.
And notice that the doctor will probably use the first person plural. We, let's not get ahead of ourselves. Now, he or she could say, don't get ahead of yourself. But that doesn't sound so nice, and they wouldn't usually do it that way. By using the first person plural, they include themselves like they're with you. They're in it.
Like when you walk in, they might say, how are we feeling today?
Exactly.
So,
they do, don't they?
Well, I'm feeling terrible. I don't know about you. I feel sick. What about you? How are we feeling today?
It makes you, it's like you're, he's there for you, you're together. So let's not get ahead of ourselves, neither you nor me. So it's very typical of them to use the we. But really, I mean, you're the patient, but that's the language they'll use. We'll wait for the results to come back, but he's not waiting for anything. It's you. He's just going to read the results when he gets them. But that's the language that he or she will use.
Exactly. Okay, so let's put some of these expressions and colloquialisms together in a dialogue that we have for you. We're going to be a doctor-patient scenario, so a role play with a doctor and a patient. Let's read it, Reza, and then look at some of the vocabulary and then read it one more time. What do you think?
Sure.
Do you mind being the doctor? I think you've got more of a commanding, calming voice than I have.
Well, I don't know about that, but I want to be the doctor because I'm just so tired of being the patient in real life.
Yeah.
I want a bit of a change.
Okay, here we go.
Good morning, Mr. Sidebottom. What seems to be the problem today?
Oh, morning, doctor. Well, I've been feeling a bit under the weather for a few days now. Got a bit of a cough and a sore throat.
Let's have a look then. Have you had any fever or chills?
Not really a fever, but I've been feeling quite achy and tired.
Right. Have you been around anyone who's been ill recently?
Well, my youngest had a cold last week, but nothing too bad.
Sounds like you might have picked up the same bug. Let me check your temperature, and I'll have a listen to your chest. Just pop your shirt off for me. Let's see. Take a deep breath in and out. And in. Oh dear, and out. Okay.
Is it anything serious?
No, nothing to worry about. It's likely just a viral infection. Plenty of fluids, rest, and maybe some paracetamol for the aches.
So, no antibiotics then?
Not this time, I'm afraid. They won't help with the virus. We'll keep an eye on it and see how it goes. If things don't improve in a week or you feel worse, pop back in. All right?
All right, thanks a lot, doctor.
No problem. Take care and get some rest.
Thanks, will do. So, what kind of vocabulary did we use there? The first line was quite clear, I think, what seems to be the problem today. Under the weather. I think we've spoken about this before. If you're feeling under the weather, you're not feeling well. Okay? You're feeling a bit sick. Something's wrong. So you're feeling ill. You're feeling bad. Under the weather.
The doctor, that was me. I also asked Mr. Sidebottom, Craig, if he had had any fever or chills. Now, what are chills, Craig?
They're multiplying, and I'm losing control.
Dr. Volta.
Because the power you're supplying, it's electrifying. Got a week. Sorry. Chills is when you're when you have a fever usually, and you feeling cold. Maybe you're shivering, and those are the chills. So your body's shaking, and you really feel bad.
So have you had fever and chills recently?
Not recently. I've had them in the past, but luckily, so far for the last couple of years, I've been chill-free, so no chills.
I was a bit worried. I was going to say to you better shape up. Let's not go now.
No, let's not go down the Greece Saturday night fever.
Pole. It's a greasy pole.
Yeah. Actually, before my dad died, the doctor put margarine and butter on his back, and then he went downhill really fast. You'd like that joke. So then we said not really a fever, not Saturday night fever, but a fever where you're sweating. And then achy and tired. Now, when we did the previous episode on the doctor, we did have the word ache, which you can have in your head, that's a headache. You can have a pain in your back, that's a backache, a toothache, an earache. But achy is the adjective. So you're feeling achy and tired. Your body aches.
So in my role as the doctor, I said that Craig might have picked up, another phrasal verb, to pick up something is to, you could be more formal, say to contract.
Or catch.
Or catch, contract or catch, but pick up is very common. A bug. Now, a bug is like any little kind of insect could be a bug, like a cockroach is a bug, or a mosquito is a bug. But whenever we're talking about medical conditions, a bug would be something like a virus or a flu or something like that. So I asked him if he'd picked up a bug.
And then the doctor kind of gave a diagnosis, but it wasn't a very definite one. The doctor said it's likely, which is there's a good possibility, that it's only a viral or just a viral infection. So viral, you might notice, comes from virus, some infection that is viral from a virus. So you need plenty of fluids, liquids, water, usually. Drink lots of water, rest, and then something for the aches.
And did you notice that we had yet another phrasal verb with pop? That's our third. So we had, first of all, pop off your shirt to take off clothes, pop up on the examination table to get up onto the table. And this time I said in the conversation, if you feel worse, pop back in. So pop back, return, or pop in, come to the surgery, and you can combine them. So if it's the first time, you pop in, but if it's the second time, you pop back in. So I said to Craig, Mr. Sidebottom, if you're still feeling bad, pop back in. Come in again.
It's very common, isn't it, pop? You might say pop round for a cup of tea or pop in for a chat. Very common. Okay, well, I think that is everything. Let's listen to the conversation one more time.
Good morning, Mr. Sidebottom. What seems to be the problem today?
Oh, morning, doctor. Well, I've been feeling a bit under the weather for a few days now. Got a bit of a cough and a sore throat.
Let's have a look then. Have you had any fever or chills?
Not really a fever, but I've been feeling quite achy and tired.
Right. Have you been around anyone who's been ill recently?
Well, my youngest had a cold last week, but nothing too bad.
Sounds like you might have picked up the same bug. Let me check your temperature, and I'll have a listen to your chest. Just pop your shirt off for me. Let's see. Take a deep breath in and out. And in. Oh dear, and out. Okay.
Is it anything serious?
No, nothing to worry about. It's likely just a viral infection. Plenty of fluids, rest, and maybe some paracetamol for the aches.
So, no antibiotics then?
Not this time, I'm afraid. They won't help with the virus. We'll keep an eye on it and see how it goes. If things don't improve in a week or you feel worse, pop back in. All right?
All right. Thanks a lot, doctor.
No problem. Take care and get some rest.
Thanks. Will do. So, we hope you will never need this vocabulary. We hope that you will be healthy and happy this year, next year, and all the coming years. But it's good to know. It's good to know this vocabulary just in case you ever feel unwell and you need to visit a doctor in an English-speaking country. But now it's your turn to practice your English. We would love to hear from you and to know what we could speak about in a future podcast. So why not send us a voice message? You can do that by going to speakpipe.com/Ingles podcast. There's a link to that in the show notes at inglespodcast.com/549 and record your message. Say hi, tell us where you're from, and give us your suggestion for a future podcast.
If you'd rather write, you could send an email to craig@inglespodcast.com or me, belfastreza@gmail.com.
And if you're a Spanish speaker and you want to improve your English with free and paid resources, visit the Mansion Ingles website. You can do that by going to mansioningles.com. And if you'd like to pay for products to improve your English, you can browse the online store at store.mansioningles.net.
As always, we'd like to say thank you to all our Patreon supporters. You might be interested in joining the Patreon program. If you do, as a way of saying thank you, you'll get instant access to the transcription of the podcast and a quite recent addition, live Zoom chats for our Patreon sponsors. Have a look at the link in the show notes. It's patreon.com/inglespodcast, and we would be very grateful for any donations.
And we don't have enough time, unfortunately, to mention everybody who is supporting us on Patreon, but we will say hello and thank you to our most recent supporters who have joined us this month. David Santana Rubiales, Ezequiel, Fatima, Angeles, and Genesis Cañizares. Thank you very much to you and to everybody who is supporting us on Patreon. Reza, what are we talking about next week?
I have been contractually informed by Mr. Whelan that next week
Mr. Sidebottom,
that next week the topic to be taken to hand will be written legal English.
Well, what a wonderful topic to start off the new year. So if you are celebrating, have a wonderful festive season. And until 2025, it's goodbye from me.
And it's bye-bye from me.
The music in this podcast is by Pitts. The track is called See You Later. I tried to look up impotence on the internet, Reza, but nothing came up.
Yeah.
Dogs can't use an MRI machine,
Why not?
but cats can.
Oh, that's a good one. I really like that one. That's cool. That's a really good one, actually.
For years, I was against organ transplants. Then I had a change of heart.
That's good.
I just had a successful liver transplant operation. The surgeon really delivered. Delivered!